Everybody being safe? Everybody ready to listen to a little bit of internox gas and air? All right. So you can hear that I have an accent. My name is Jannik. I'm Danish. So yes, I do speak with an accent, but I hope I make myself understandable. I'm the international sales manager at Medclair, and Medclair is a Swedish technology company that really focus on technology for internox programs being safe, both for staff, but also for the external environment. So this is what we're going to talk about. With me, and I have been invited by BPR Medical, so maybe we should let Angela introduce herself and the company.
Okay, so I'm Angela Owen. I'm a business manager from BPR Medical. So BPR Medical focuses on our ultraflow system, which is a internox delivery demand valve for nitrous oxide. So we are a medical gas therapy solutions company, and obviously we focus on the inhalation side of ladies giving birth with nitrous oxide.
Thank you, Angela. So Medclair focuses on the exhalation part, and just to give you a brief background on who I am, I have spent the last 13 years traveling around to a lot of Scandinavian hospitals educating about the safe use of internox. And in Scandinavia, we do it very differently than you do here in UK. And I see a lot of young midwives, maybe you're some of them, going around here. And I think you should focus on it. I mean, you will be working with this pharmaceutical for the next 30 years of your lifetime. And I mean, if I just now raise the flag and say, hey, how many of you have actually read the product resume on this pharmaceutical? I know I did it in Copenhagen last week, and there were 130 midwives. And I asked the same question, how many of you have actually read the product resume on this pharmaceutical that you're now going to be working with for, let's say, 30 years? And I got very few hands up in the air on it. That's the whole message. I know I'm only going to spend 15 minutes with you. I think you should go home to wherever you work, and I think you should focus on the inhalation part and see, okay, how is that done in your labor department? How is it done? And I think you should pay attention and look to how is the exhalation done, because you're gonna work in an extremely high flow area, meaning that if I now go into hospital different settings, will there be anyone using the same kind of high flow as you are using with these pregnant women? I doubt it. I'm an ICU nurse myself, and I mean, these women that you're going to work with, they really blow out air to the extreme, meaning that the focus on COVID-19 is also relevant, right? So key message, go home, focus on, okay, how is this done? Inhalation, exhalation. I think that exhalation be removed from staff. This is how we do it in Scandinavia. I mean, if I now put myself into any Scandinavian midwife setting and say, hey, are you okay with, I now come in with an open approach, meaning that I support a mouthpiece, I support open inhalation and exhalation afterwards. Are you okay with that? All the Scandinavian midwives will say, absolutely no. Absolutely no, because we focus on two patients, both the mom and the baby, and they don't want to take the risk of being exposed to this themselves. So very easy, I think, to go home to anywhere where you are and say, hey, how do we do it? We did a road trip 2 months ago. We went to different hospitals in UK, and we had this device with us and this device. We went to 2 hospitals in London, we went to Manchester, we went to Newcastle. And Newcastle had their entire communication team already being set up. And they went out with the story saying, hey, first baby for 0 admission. And this is what they did, right? I mean, a brave midwife took this device and said, hey, I'm ready. This is not very sophisticated. It's an on and off switch. She took the device, she wheeled it into a baby delivery. She took this demand valve, inhalation, exactly like she's used to. Exhalation, she added on a hose to capture and redirect all the exhaled gas away from her into this device. And this device is a thermal reaction device that breaks it down to nitrogen and oxygen. And why is this important? I mean, why break down the exhaled gas? Nitrous oxide is a greenhouse gas. And if you have the Internox program rolled out throughout an entire baby delivery, how much is that equal to if you put yourself now in your car and you start to drive? How many, sorry, I do it in kilometers, how many kilometers could you actually drive? 1,500 kilometers. It's the same CO2 footprint that you leave behind. And think about it, 1 kilo of Internox is equal to 300 kilos of CO2. So what do we do in Scandinavia? What is different? Everybody captures the exhale gas. It's not all the time wheeled into this device, because I admit it, this device is big and clumsy. We take the exhalation hose and we put that into an outlet. That's called an AGS outlet. You have it already in your hospital. The anesthetic doctors works with this outlet. Midwives will plug it into the same outlet because they already have it. And that outlet behind is a pipeline system running into a big unit. It looks like an oversized fridge, basically. And in that fridge, we destroy nitrous oxide to being oxygen and nitrogen. So that's the mission here in UK, right? You have this NHS document now saying zero admission, we focus on Internox, we need to make that clean. Yeah, it's a win-win situation for midwives, because if midwives are really good at this capturing and removing, we're doing something good for the environment as well. So it's a win-win both for you as being midwives, but also for the external environment. This is the mom, right? I don't know if you saw this story in BBC News, but I mean, this is the mom that said, okay, I'm going to be the first mom, zero admission baby. I like the story, but I really like a lot that there was a brave midwife saying, hey, this is not, robot, this is not sophisticated technology. I can wheel that into any baby because it's an on and off switch. You turn it on, it heats up to 400 degrees, you connect it to electricity, and all the exhale gas coming into this device will be destroyed to nitrogen and oxygen and fall to the floor. What have other hospitals done? They have a couple of devices with the midwives, and they show how good they are at this technology. With the good results, they come back to the piping people and say, hey, now pipe in a full piping system to us, and we can take care of the rest. Now they have done something good for themselves and for the external environment as well. But I mean, the mission starts with the midwives. A lot of publicity on it. I saw that last week the BBC Scotland went out and said, hey, you actually have this device in Edinburgh. So the hospital here went out and said, hey, Scotland, we can do the same thing. Here's the first baby delivery for zero admission. I like the story, but I like even better that we have done something good for the midwives. Added safety to their work. I think this is going to be important. So that's kind of the bring home message to you, right? Go home to your hospital, read up on the product resume and say, hey, this is something that we're going to work with for 30 years of our lifetime, some of you. How do you want to do it? I suggest that you use a closed system. When I talk with Danish midwives, and I ask them, what's going to be the preferred way of dosing the gas to your patient? What do you think they answer to my question? A mouthpiece or a face mask? Think about this is COVID-19 time, and you're going to be standing there with a high flow therapy to a patient. You're going to be exposed to a lot of things. So I do think that you're going to be less exposed with supporting a face mask to the patient. And midwives in Scandinavia, they address it. They say to the patient, listen, I want to focus on both you and your baby. If you exhale and blow out all this gas to me, I cannot focus. That's the risk. Are you okay with using a face mask? This is face mask times, right? You're sitting there, all of you, with face mask. Of course, the mom understands this and say, yeah, let me use a face mask. So I do think that that's the key message to you. Go home, look at what the situation is in your department. How do you want to do it? Angela, BPR Medical, I'm a technical guy. I sit in a technical company. We rely on partners. BPR Medical has a footprint here. I'm going to fly back to Copenhagen, talk with my Swedish colleagues. We're a technology company. What I have here in my pocket is, of course, a microphone because we're taping this. But I also have this. And a lot of hospitals are now asking us to provide this. This is a nitrous oxide detector, personalized. So like you're seeing all these X-ray people going into a hospital and they wear small canisters. They do that to protect themselves against X-rays, right? In Scandinavia, we do the same thing, except that we already now support a closed system for inhalation and exhalation. But we do this as a coaching tool because this will send a beep, a warning beep if you're now exposed to a heavy dose of nitrous oxide. It's a coaching tool, right? Because now you need to address the mom and say, hey, could you use the mouthpiece or the face mask a little better because now I'm being exposed heavily to this and I need to focus. So we'll send a beep. It's a personalized detector. I think that's the time that we have, right? Any questions from any of you to this? If you had come home now and say, hey, we did not, what did they talk about? Please connect with Angela and BPR Medical. Go home to your hospital, talk with your colleagues about it and read the product resume, right? You should protect yourself here. You're going to have a long career in midwifery, and I do think you should protect yourself. Scandinavia has these midwives are really, really powerful on it and say, of course we need to protect ourselves. And it's basically simple, right? It's an exhalation hose. And then you guide it to wherever you are. I also do talk to a lot of midwives in home birth settings. Okay, how do you protect yourself in home birth settings? Very simple, because you're going to be using the same device from BPR Medical. Now you have this in home birth settings. How do you protect yourself? What do they do in Scandinavia? The system. And then they just, add on the exhalation hose, and then they pull that out to be as long as they wish. I have seen the same thing with this device. I mean, that device can be wheeled into a corner because you don't want to have it. Okay, then you build the exhalation hose to being longer and longer. It's the same thing in a home birth setting. Protect yourself. How do you do it? You add an exhalation hose and you pull this, place it wherever you want it to be placed. You should focus on the mom and the baby. All right. Thank you for coming in and listening to this small session. I hope you found it useful. Key message, go home, look at what you have. And if you have something that looks to what I just said, open system, open approach, call my friend here.
Absolutely. If you want to leave your details on the stand, we can get in touch with you, send you more information on the system.
Thank you for coming in.
Thank you very much.